Let us now talk about diarrhea, the spleen, and kidney yang deficiency. The clinical manifestations of spleen and kidney yang deficiency are early morning diarrhea, slight abdominal pain, borborygmi, which stop after the bowel movement, weak back and knees, dizziness, tinnitus, feeling cold, cold limbs, frequent pale urination, tiredness, poor appetite. The tongue will be pale and wet and the pulse weak and deep. The treatment principle is to warm the kidneys, strengthen the spleen, and stop diarrhea. The points to be used are REN 12, bladder 20, stomach 36, spleen 6, bladder 23, bladder 25, stomach 25, stomach 37, REN 6, and DO 20, using the reinforcing method and MOXA. The explanation for these points is REN 12, bladder 20, stomach 36, and spleen 6 tonify the spleen. Bladder 23 tonifies kidney yang. Bladder 25 and stomach 25, the back transporting and front collecting points of the large intestine, they treat chronic diarrhea. Stomach 37, the lower C point of the large intestine, stops chronic diarrhea. And REN 6 with MOXA tonifies qi and stops diarrhea. Indirect moxibustion on ginger is a very effective method of treating this type of diarrhea. And DO 20 raises sinking qi. Let's talk about a case history of a 30-year-old man who had been suffering from diarrhea since he was 16. His stools were always loose and occasionally like water, and he had up to 8 bowel movements a day, all in the mornings. His sleep was poor because he woke up frequently during the night, feeling his throat dry. He also suffered from tinnitus and impotence. His pulse was fine and deep, and his tongue was slightly red and swollen, with a coating slightly peeled in patches. The diagnosis is a condition of deficiency of both kidney yang and kidney yin. The symptoms of kidney yang deficiency are impotence, diarrhea in the mornings, and swollen tongue. And the symptoms of kidney yin deficiency are red tongue, peeled coating, tinnitus, insomnia, and dry throat. The treatment principle is because the diarrhea was his main concern, because the frequency of bowel movements in the morning severely interfered with his work, so attention was directed at treating this first. In order to treat the diarrhea, kidney yang should be tonified and warmed. However, he suffered from a deficiency of both kidney yin and kidney yang, and tonifying and warming the latter with a kidney yang herbal formula would definitely aggravate the former. In such complex cases of deficiency of both yin and yang, acupuncture is often preferable to herbal medicine, because with acupuncture, the kidneys can be strengthened in general without any special emphasis on yin or yang. The acupuncture points used with the reinforcing method were chosen from the following: stomach 37 and bladder 25 to stop chronic diarrhea, bladder 23, kidney 7, REN 4, and REN 6 to tonify the kidneys, heart 7, and kidney 6 to calm the mind and promote sleep. This patient needed treatment for over a year in order to achieve a cure, as his condition was very long-standing. The prognosis is his diarrhea responds very well to treatment with acupuncture and herbs. Acute diarrhea responds practically immediately, and acupuncture and herbs or patent remedies are probably the medicine of choice in his condition. As for chronic diarrhea, this naturally takes longer to treat, and occasionally it may be very stubborn. If it is due to kidney yang deficiency, male patients should reduce the level of their sexual activity. Thank you so much for your attention.